Today we're going to talk about the effects of lifestyle changes on type 2 diabetes. The Centers for Disease Control and Prevention estimates that more than 29 million Americans have type 2 diabetes and another 86 million adults have prediabetes. This means that their blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. Without weight loss and moderate physical activity, though, 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years. The pick-up question that I used to begin to search for literature for this review was, in adults with type 2 diabetes and obesity, how does lifestyle changes such as diet and exercise compared to bariatric surgery affect blood sugar levels within 3 months? In addition, I also used some key terms to search, and they included type 2 diabetes, lifestyle changes, and obesity. I used PubMed Central Database and EBSCOhost Academic Search for my search for literature. There were 3 randomized controlled trials that were looked at for this review. One study looked at a self-monitoring disease management strategy. This was primarily led by diabetes nurses. The second study used a structured individual-based lifestyle education program versus usual care. And a third study looked at the importance of how obesity contributes to poor glycemic control and the increased risk of cardiovascular disease. It also included a very low-calorie diet of less than 800 kilocalories per day with a combined psychological intervention. The findings in these studies for the self-monitoring based disease management strategy show that there was a mean reduction of the hemoglobin A1C level of 1.2 plus or minus 0.1% in the intervention group versus 0.7% plus or minus 0.2% reduction in the control group. It also determined that with improved metabolic control, it does lead to weight loss. In the structured individual-based lifestyle education program, there was also a mean change in the hemoglobin A1C level from the baseline. There was a 0.7% decrease in the intervention group versus a 0.2% decrease in the control group. The very low-calorie diet with the combined psychological intervention study determined that it was effective in maintaining weight loss, that there was improved cardiovascular risk and glycemic control, as well as improved quality of life for the patients. So how can these findings be beneficial to nursing practice? My proposed intervention is to form an education program that incorporates diabetes education, a support system, and nutrition counseling for any patients that are diagnosed with type 2 diabetes and obesity or both. It would include how to monitor blood glucose levels. It would ensure that patients understand the importance of glycemic control to prevent complications that are associated with type 2 diabetes. And it also would include an exercise and activity regimen that the patient agrees to, which would include activities that the patient chooses. We would want to empower the patients in the decision-making process and tailor it to their interests and their preferences. I feel that this type of program would work well in primary care clinics and health departments.